Dr. Sunline here. Today I'd like to share with you a problem that we're seeing a lot more frequently, and that is patients who have had permanent fillers put into their upper lip and lower lip. Today our case is a patient who went to Mexico. She had silicone injections into her upper and lower lip. Initially very pleased with the results, but as is the case with many silicone injections, the problem is the muscles move the material and it migrates. It can migrate within the face and migrate in the lips. And so now she's been left with these bulges of her upper lip with a crack in the middle that actually has problems healing over. And she's constantly having to wear like chapstick to get the area to heal. She has bulges in the lower lips on each side, which is actually the silicone pushing kind of through the muscle layers to get to the outside. And then of note is her dental midline is not the same as the midline over her lower lip, which is actually shifted to her right. So we took her to the operating room, we sized these out, and she did very well from this. She has the picture you can see now, her post-operative picture, and in that you see, I think, an improved appearance of her lips. She still has a nice, full, voluptuous lip, but it's not as pronounced as it was before. The balance of the lips is restored. Those big bulges of the upper lip are gone. The lower lip is better and more balanced as well. And we've shifted over the dental midline with a small intraoral wedge resection of her lip. And I think this is going to be nice for her. If she wants further augmentation of her lips in the future, I would say she should do some fat injections to her lips. We're doing these in the office now. We've had very pleasing results from them, and I think it's a better alternative than the use of permanent silicone fillers. So thank you for your attention.